Is an overly tight mouth and jaw area prematurely aging your face? That is what Dr. Nick Mohindra, a dentist from the UK, says happens to all of us. If you don't know what a dental facelift is, stay tuned because I am going to be interviewing Dr. Nick. I interviewed him earlier this year. We're going to go a little bit more in depth with some questions that we get. If you have heard of the Oralift, it is basically you buy it, you get two sizes. So it opens up space through the jaw. And what this does over time is it sort of makes the body adapt to a new facial structure. Over the decades, we get less blood supply and all sorts of things happen with an overly tight jaw. Everybody has an overly tight jaw. If you'd like to find out more about the Oralift and how it can help you look younger and feel better, stay tuned. Coming up next, my interview from Oralift. Oh, also, we are having a sale where they are giving you, I believe, 15% off, and then you get another percentage off if you use my link on my website. So it's a perfect time to pick up an Oralift. Here you've got some exciting news for us about a study that was done.
That's right. That's right. This is a study that was done this year, and the results of it are very exciting. I mean, we can only afford to do so much studying at the moment, so many clinical trials at the moment. And this was quite a short study. It was for 2 weeks. And we wanted to know what results could be achieved on the facial skin in 2 weeks. And I think it was very exciting that even after 15 minutes, the study showed that the blood flow and the skin physiology was starting to change. And this is what I expected. You know, we get sometimes very good 10-minute results after using Oralift. And the 2 weeks results again showed that there was a reduction in wrinkles of 12.5%, and the skin elasticity had improved by up to 20%. Now that is really quite exciting for some appliance to do that in such a short time.
So these were controlled studies. So your clients weren't using, they're not like my clients that use all these devices and stuff, right? They just use the Oralift and nothing else, correct?
That's right. That's right. This was a study done by an independent company, you know, so we weren't involved with this. The study I did in 2018, although it was done in association with one of the leading dental hospitals, but these were all my patients. But this study was an independent study done by a company called Q-Test, and they did the study for me. And I think that if we look at the two results of what we got in 2018 and what we got now, it really is encouraging because the 2018 study showed that skin changes even after 8 months. All the participants thought their skin had improved. And now we're showing that the skin changes start to occur within 15 minutes of starting wearing the Oralift.
Wow.
And they continue, you know, for years to come.
That's crazy. You know, after our last interview, I took my Oralift out and I started wearing it, and now it sits beside my bed. So I'm like, I can't forget it, you know? And I don't do it perfectly, but I do feel like I've gotten some results. I feel like I'm a little less liney through here, a little less puffy. I get less sinus headaches. I don't know if I'm allowed to say that, but and if I get a sinus headache, I'll be like, have I used that, you know, in the past 2 days? And like, I'll put it in, you know, but yeah, I really love how my jaw sort of sets a little, it just sets differently now. I'm not clenching, and I definitely notice when I am, you know, in traffic or whatever, I notice. So it's fascinating. Can you give us a quick rundown on how it works? Just a simple.
Again, it is unique in the sense that it uses the ability of the body to adapt, and it's the facial muscles having to adapt to a new jaw position when the Oralift is worn. So what does this process of adaptation mean? It means really adaptation is very crucial to a species. To be able to survive, we need to be able to adapt. And therefore, when we say the facial muscles have to adapt, what we really mean is every cell in the body has to change and work to its best ability. And that is what is happening. And this is why, although this study only studied the skin changes, but as we know from what patients have said, there are lots of other changes that are occurring, which people have reported. You know, you say about sinusitis, I use it for controlling my asthma. Other people have used it for different purposes. I think one of the most important things is the improvement in posture. You know how the posture improves. That I think is incredible.
I was going to say that because I noticed that my neck, like when I really started to use it, about 2-3 weeks in, I'm like, ow, what's going on back here? And I noticed I was less forward flexed, and I was like, nice. But yeah, it starts working, you know. Well, you think about all that space that collapses, and then nothing's moving, nothing's working, you know, quite like it did when we were younger. So it's really fascinating.
You know, one of the stories I remember about posture is I had a South African TV presenter when I was working as a dentist, and she had the Oralift treatment. And she noticed the improvement in posture, but her main concern was that after having had a baby, she lost a lot of weight, and it showed on her face. And she says, this has put the volume back in my face. But she says, the other thing I've noticed is my breasts were starting to sag as well. And since I've used Oralift, they have uplifted. And the reason for that is the posture improvement. You know, as the shoulders go back, the tummy tucks in, and that was
oh wow,
fascinating when I heard about it, you know. And now when I look back at what's happening to the posture, yes, it's not just the head, but the whole body posture is improving, you know.
How extraordinary. That's so cool. So if you haven't seen them, they come like this. You get a set of 2. And I believe you guys are having a sale that coincides with our Labor Day. I don't know.
That's right. We have a sale on where we get a 15% discount on the website. But if they use your coupon, they'll get an extra 10.
Yeah, so you get a set of 2, and these aren't hard plastic. These are high quality dental material, and you know, they fit to your own teeth. One is 3 millimeters and one is 5.
Yeah.
One is
really, you know, the blocks on either side, they are 3 millimeters and 5. It's interesting why we chose those heights, because when I first started in this Oralift journey, I used to have to manufacture an appliance to fit the teeth for individuals who had to take impressions of the teeth and then decide on what, by using the swallowing technique, how high the block should be. But then I realized the height of the blocks varies in every individual because the state of their facial muscles, some are very tense and some are relaxed. And we found over a period that perhaps 3 and 5 are the 2 best sizes to use, which will suit practically everyone, you know.
Mm-hmm. Well, good. That makes sense to me. I mostly use my 3 because I have a smallish mouth. I'm going to work up to the 5. I know it's not a race.
No. I think the important thing is to look at your results. If you're getting very good results with 3, there's no need to change to 5. If you think you're not getting very good results, then I think it's a good idea to change to 5. And also, the higher the appliance, what I used to find was if you wanted improvement in the top half of the face, the higher the appliance, the better the results were on the top. But again, we need to do a lot more research before we can individualize an appliance to every individual, you know. At the moment, the guidelines if you follow the guidelines, but don't necessarily have to be too strict about the guidelines, you know.
Yeah, I feel like I know if I've overused it, and I'll back off. I mean, just intuitively as an esthetician and, owning my own body. But I think, and we were talking about this last time too, is that people have so many questions and they're so afraid of getting it wrong. But really the biggest point is use it, right?
Exactly, exactly. Even if you use it very little, I think once you initiate the healing process, that the process of adaptation starts off, you'll find there'll be benefits. Recently, someone got in touch with me, and they'd had their plans for 2 years, and they used it initially for, I think, about a month, and then they didn't use it. And I got them to take pictures again. When I looked at the pictures, I could see improvements. So I said to the user, and I said, have you been using any other treatment? Are you using microcurrent? Are you using this? Or are you using that? She says, no, I don't use anything else. I do face yoga, and the only other appliance that I used was yours. And the improvements in her case, even with using it for very little time, were incredible.
And 2 years later.
Yep.
Wow. Yeah, I imagine that facial yoga probably tightens things up almost maybe too tight. I've seen some facial yoga people that look absolutely buff, which is the look. They just look buff. But I think done right, it's a beautiful modality. I don't do it. I don't have time for it, and I have other devices. But yeah, I would imagine that I think facial exercises can have unintended outcomes sometimes.
Yes, I think you're absolutely right. The problem is, because everyone is different, some people who clench or are very stressed, they've got very exhausted muscles. And the last thing you want to do with these exhausted muscles is make them even work harder by doing more exercise with them, because that will lead to muscle atrophy. Therefore, in those cases, the most important thing you can do is relax those muscles. And this is what the Oralift does, deprograms the muscles. As soon as you start to wear them, it deprograms them and relaxes them. So don't overdo it, just let the muscles relax in these cases. But in cases where the patient is very relaxed, then they can use it for as long as they want. It is very individual, the treatment. And I think people who get worried about, are they doing it right? What I say to them is, look, the best way is monitor yourself, take pictures regularly. If you want, with the app, you can take pictures every 2 weeks or every other day if you really want to, but that'd be too much,
That might make me crazy, but yeah, every other, yeah. I think I would do them monthly, just not make yourself crazy, but.
Exactly.
But just take them.
And I think, when you look at the study that we have done now and look at the study we did in 2018, and then you look at the skin results, I've got a picture of someone who's used the Oralift now for 16 years.
Wow.
And if you look at her skin now, the skin looks as flawless, or I think even better than when she was 16 years ago.
Yeah.
In her case, really, because Oralift works in so many different ways, in her case, what you can see is that the jaw that used to protrude out, she had a sort of, in dentistry, we call it a skeletal class 3 relationship. So her jaw used to protrude out, and now it's gone back, and the profile is lovely.
Wow.
And that's without surgery.
That's incredible.
Yeah.
So a lot of people do ask me if it will change your bite, and I'm like, I really don't think so, but maybe in a positive way, if it does.
I don't think it. When we talk about changing bites, it usually means moving teeth to get the teeth to touch together in a different way. So this appliance won't move your teeth at all, But what it does is change the position of your jaw three-dimensionally. Now, changing the position of your jaw, then it means how do you eat? Because your jaw's in a different position. But the brain is very clever, and it'll adapt, it'll form a new way of eating and swallowing, but it doesn't move teeth in any way at all.
And I also get people who ask, what if I'm missing a few back teeth?
Again, as long as you've got one of your big teeth, the big molars at the back, the appliance will fit. If you've got all your molar teeth missing on one side, then it'll be difficult to fit the appliance. Not impossible, but it'll be a little bit more challenging. And what I do is, if someone's got all their back teeth missing and they have bought the appliance, then I'll get Sue to go over the fitting process with them,
Mm-hmm.
And they can do that with a Zoom call.
Yeah, because I know a lot of people get kind of freaked out about that. And it's not as hard as it looks, I think. It's just not. I didn't mess up mine. If I didn't mess up mine, anybody can do it.
It is very easy. I think that's the other thing. People overthink that it's going to be, it won't fit properly. We're used to having dental appliances, and dental appliances, when they fit on the teeth, they're supposed to fit really securely, and this one depends on how relaxed your facial muscles are. If your facial muscles are very relaxed, it'll fit quite firmly on your teeth. If your muscles are very tense, it'll lift the appliance up and it'll make the appliance move up and down. And people think, oh, I can't have fitted it right, No, you probably fitted it right. It's just that your facial muscles are very tense.
Yeah, and that eases up. Yeah, mine used to just pop right back out. It would pop up off my thing, and I'm like, I had to use my tongue to hold it down in the beginning.
People also say, where should my tongue lie? When I'm got the appliance. And if it is popping up and down, you can use your tongue to hold it down. But otherwise, let your tongue rest in wherever it feels comfortable,
Yeah, I noticed over time I didn't have to do that anymore. I didn't have to consciously do that anymore.
No.
So do you have any more new before and afters?
Well, yes, we're getting before and afters all the time,
We love them.
I've got Cher, and she got an excellent 10-minute result. And our study, which showed that the skin starts to change within 10 minutes, the skin physiology and the blood flow, you can see how her wrinkles reduce within 10 minutes of using the appliance. And then after a month, you can see how that's been maintained and the skin is still looking better. This reminds me of an incident where I was lecturing in Italy at the time to some dentists. And one of the people who was there, she came in and she said to me, Dr. Nick, I don't use the appliance the way you advocated because I find it quite difficult. But the way I do use it, I use it for while I'm putting on my makeup before I go out. And she said, because I know when I go out and I've used the appliance, I look much better. And that's the 10-minute result that we're talking about,
Right.
Use it for 10 minutes and you look much better.
Oh, wow. If she gets her makeup done in 10 minutes, she's fast.
That's right.
Yeah.
She got a very good 10-minute result, obviously, and she could notice it, and that's how she used it. One shouldn't get too worried about the program. It's flexible. Just monitor yourself and look at the results.
And use it. Just use it.
I think that's the most important thing. Obviously, we need to do a lot more research, but research is very expensive. I remember about 3 years ago, this was going to be a double-blind study done over a period of 10 months, but the cost of it was going to be $1.5 million.
Whoa.
For one day, perhaps we'll be able to afford that sort of money to do trials, but not at the moment.
are you still doing your Zooms to customer service Zooms or those?
Yes, that is still available. Do your onboarding, get the appliances fitted, and after that you get a chance. If you're not sure that you've done it right or anything at all you're worried about, you can have a Zoom appointment. At the moment, as us, we've only got a Zoom appointment every Monday.
Yeah, I know you were doing like group Zooms on Mondays.
That's right.
I wondered if that was continuing. Yeah, you guys have really good customers.
We are hoping to get a new version of the Oralift where we will provide more support, but not at the moment. At the moment, it's just the Monday appointments.
Yeah, but you can learn so much. Thank God for Zoom, because if you're considering getting an Oralift, it is so simple. Fit it and use it, and try not to overthink it.
That's right. And Zoom has made the world a much closer place. Wherever you are nowadays, whether you're in States, we are in London, people even from Australia. Australia is the most difficult place to communicate on Zoom because the time difference is quite
yes.
big. Even there, we have been able to get people to join in on the Zoom appointments, And I think with any new treatment, you can't be sure that you're doing it the right way. And it's only natural that you want someone to say, no, that's okay, you're doing fine. It may only take 2 minutes to say that, but that confidence that it gives you is so important. And that's why we introduce the Zoom appointments. What I say to people is don't ever feel afraid to join in. You can join in that Zoom appointment anytime in your first year when you bought the appliances.
Oh, that's beautiful. That's a great thing. That's a really good customer service. So what is this made out of?
It is made out of like the hard blocks are nylon blocks. So there's nothing that leaks out of them at all. The thermoplastic material, which is the bit that molds over your teeth, is a EVA, but it's been tested to make sure that the coloring or nothing from the thermoplastic material can leach out. So the testing was done by one of the testing laboratories in, I think it's in London or South Wales, and it's been tested thoroughly.
Yeah, but I've heard people say, oh, it's just a piece of plastic. I'm like, no, it is soft. It is high quality. I mean, it's a dental appliance, essentially. Right. It's like what we're going to have a Chinese chunk of plastic you put in your, look, it's soft. I don't understand, but it is a beautiful thing. It is such a clever product. I'm so glad that we did it.
It's not very much plastic as well, because it is also the support that you'll get. You should never ever feel alone with this bit of plastic. We are there to support you. If you're not doing it right, we'll advise you. So all that is included in the package.
Yeah, no, it is so worth it. It's such a simple thing, but it makes such a difference. And then I really love how this, say you're using all your devices and you feel like you're getting nowhere, and then you add this. If you're like a severe clincher, you add this, and everything you're doing blooms. You get new circulation to the face, and circulation to the face when you're trying to anti-age is golden. It is what I'm always trying to bring, and I'm always trying to sweep out lymph and bring in new circulation. And this does it. And we work up to an hour a day. But yeah, this does it. And that has so many other.
So passively, you don't have to do anything. You can wear this appliance while you're working on your computer, watching TV, whatever you're doing, driving. Easy to do once you get into the routine. But it's a routine that, as you experience, and I find it too, you can't be too strict with the routine. Then it becomes not nice, So don't worry if you can't follow the rules exactly. Just do what is best for you.
Perfect. I love it. Well, thank you, Dr. Nick.
You're welcome, Christine. Any more questions you get from people, just pass them on to us and we'll answer them. Or they can contact us directly,
Yeah. Awesome.